Hello, everyone, and welcome to A Wider World, where we celebrate the abilities of all. I'm Elizabeth Kelly. In 1966, civil rights icon Martin Luther King Jr. said, "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." So why does health insurance matter? People without insurance are more likely to go without preventive care, to delay or forego medical care, and to die prematurely. When sick, the uninsured may turn to emergency rooms for care, where oftentimes they are charged more for services than insured patients. And when uninsured patients can't afford their medical bills, the cost of this care is passed on to the insured in the form of higher premiums. So who are the uninsured? By and large, it is working Americans and their family members. It also includes the growing population of more than 3 million Americans who are also homeless. According to the National Conference of State Legislatures, the number of people without health insurance has increased steadily since the beginning of the 21st century, now totaling about 47 million Americans.
It's really scary. It really is, because we're talking about people that at one time had health care, had jobs, had homes, and to be able to deal with that, and they have families. Then after a while, they just take on another form of life because they just can't cope with the system and some of the demands that are placed on them and the way they're treated.
The system has to change, and I'm really afraid it's going to get worse instead of better, because I think there's going to be more money eliminated, especially for Medicaid. And I know there's going to be money eliminated for Medicare. So people are not going to be receiving better health services in the future. They're going to be receiving worse health care services.
Our huge challenges, of course, is the uninsured. And then our next huge challenge is multiple diseases that the patient comes in with. And most of the time, even if they have an insurance, many people don't follow up and see a physician on a regular basis. So when they hit our door, they don't have one thing wrong with them, they have 5.
Medically indigent. That's a new term coined to indicate either those without health insurance or with inadequate coverage. The decline in employer-based coverage, the high unemployment rate, and the slow economic recovery has created huge obstacles to receiving regular and necessary healthcare services.
We have people coming in the door now that were always employed and are now not employed. And, you know, co-borrowing your insurance and trying to pay health insurance and paying your mortgage and put food on the table, well, guess what goes first is that insurance.
I think an awful lot of people are not getting medical care, just very basic medical care, especially from my experience here.
We see people come in daily needing just referrals to doctors, they need prescriptions, just need basic care, and as well as extended care.
I think people tend to forget that it's a very cumbersome system at times, and I think outpatient resources are just not there, and we need more of them. That's another thing. And we need to let people know how to get them and how to qualify for them. And qualifying them, no one should not qualify because they make $5 more than the sealed limit.
And I think it's going to get even tougher because of cutbacks and things that are going on. The help is not going to be there. And that's the sad part about it. And to see someone that need the help and not be able to help them, that's hard. Individuals that are homeless have, you know, a common cold be one thing, but then it leads to bronchitis, pneumonia, and sometimes even death. And that's sad, where sometimes even just the basic service could prevent things going on any further.
Jim Stewart is the shelter manager for the Hope Warming Center, a seasonal cold-weather homeless shelter in Pontiac, Michigan. Nightly, the shelter deals with the consequences of no health coverage and its impact on the homeless guests that stay there.
Well, we do our best to keep an eye on folks and to attend to their needs as they come up. We have had a number of ambulance runs for different kinds of things. We have a nurse that comes in on Thursday nights, and she identifies some problems with the guests, and through her we try to keep an eye on them. But yeah, these people tend to be pretty challenged. their health isn't the best. So we've had, you know, everything from the frostbite issues to people that could be having a heart attack, people that could be overdosing, alcohol poisoning, any number of things that they might be, you know, so we send them in an ambulance, or sometimes we send them in a cab to the hospitals, or we try to connect them with medical services.
I started volunteering as an RN at Hope about 3 years ago, and I come here once a week and I try to evaluate, triage essentially, the patients. If they need medical care, then I try to send them to wherever they can receive that care. Sometimes it's in a hospital, sometimes it's in a clinic. Well, my experience with referring patients has been very, very frustrating, especially when I initially started out. I scoped out all the clinics, called them up, asked who they would see, when they would see them. They assured me that they would see our guests, and then they didn't. They would refuse them. So finally, the second year, we got some help from Marlene Mullen, who is on our board, who is a nurse practitioner, and she kept insisting that these people now would see our patients definitely, our guests definitely, and then they didn't. And so finally this year we got very, very assertive and started calling and meeting with these people and explaining the problems that we were having. And finally we've gotten some results. But the frustration with our population, and as a matter of fact with the indigent population, is you have to make an appointment with the clinic sometimes 6 weeks in advance, and you have to have certain qualifications. Either you should not be insured with some of these clinics, or you should be insured with other clinics, or you have to be the working poor. So it's really very complicated. So if you cannot track through the system, you're not going to get medical care.
Gary Kirkall and his friend Jim Evans are homeless and uninsured. In the wintertime, they live at the Hope Warming Center.
Well, we're partners on the streets and that, and walking about with tennis shoes during the winter and stuff, no place to go, and feet would get wet and cold, and we try to warm them up and get wet and cold again. And many times, like you said, we'd get our socks wet. There was times we didn't even have socks and stuff. We had no ways of getting any. And that's what started with frostbite.
Last December 12th of 2010, we had a big storm. And of course, being homeless, I walk on the streets all the time, so I was accustomed to having my feet being numb. But so my feet got wet and cold, and they were numb, but I assumed, well, that's typical. So I made sure I was wearing dry socks and stuff. So I didn't really notice it at first, and then a few days later, I went to take a shower, and my toes were black, and my feet were starting to turn black. And I had red streaks going up my legs, so right then I knew I had a serious problem. So I was admitted into POH. I had the warming shelter call emergency, and they took me there. Well, they came and looked at me, and of course my feet were in terrible shape, and there was about 4 or 5 doctors that came in and looked at it, and they all concurred, and they said that some amputation was going to need to be done. So after that, they, you know, did processing on me, put me in a room, got me on antibiotics and all that. And then they waited a couple weeks before they did the first operation because they were trying to see how much of my feet they could save.
Yeah, so I saw what he was going through, and I visited him several times. And I believe it was 2 days after he was in the hospital, I was in the warming center, and my feet started hurting like crazy. So I got with Mr. Jim Stewart, the head person here, and he said, "You want to go now?" And I'm like, "Yeah." So I went to the hospital, and I was in for a few days, but my feet weren't turning black at the time, and they released me. And I'd say about a couple weeks after that, then my toes started turning black. I'm like, "Oh no." And I saw the state that Jim was in. I'm like, "Oh no, I got to get something done with this." And so I went back in again. And I was in for approximately 12 days. They operated, took about 3 toes away. And then I started getting an infection. I had to go back in again. Like Jim said, I feel we were released too early. And with not having insurance, I think that had something to do with it.
No, I had no insurance, and actually I was quite worried about that because I didn't know what kind of care I was really going to receive. And actually I was really surprised because they were very caring, and they were very careful. It's not like they rushed into it and just like amputated my feet right away. They gave him time and tried to save what they could on him. So I was actually very impressed by that, because I was in the hospital for a total of 3 weeks the first time, and with no health insurance, and I know that must have really racked up a bill.
I think one of our biggest problems with healthcare in general is that we don't we always talk about keeping hospital dollars down, and that this is a very expensive institution to run. And you also have to understand, anybody who walks in our door, we treat, no matter who you are, race, color, or creed, whether you have insurance and don't have insurance, we don't treat anybody any differently.
I think considering that I had no insurance, I was very pleased with the care that they gave me. They were very kind, compassionate. I even mentioned it to the doctors and the nurses. You know, I know I'm probably a burden on the hospital because I don't have any insurance, and the doctors told me don't worry about the money because the important thing is that you get better.
Woman doctor, I mean, I'm sorry, she was a doctor. And she was so curious how I got frostbite. And I says, well, mine's not near bad. You see my friends? He's right next door. Well, they work different sections. She says, no. And I says, heck, he's 10 times worse than I am. And she went out and she says, well, I want to make sure you get some shoes or boots, because our tennis shoes had holes in the sides and stuff. And she just said that. I'm like, well, okay. And I thought maybe they had a closet somewhere in the hospital and they'd find me something. And I went somewhere in the hospital for x-rays or something or other. And I come back, say, an hour, 2 hours later, brand new box on the floor at the foot of my bed, socks, underwear, socks and gloves. And even bought him something every met him.
My nursing staff and my social services staff, example of things like we do, particularly dead of winter, no one ever would get out of here without a coat if they come in without one. We have a coat closet. They can't afford the walker. They can't afford a cane. They can't afford a wheelchair, those types of things. And we're always stashing stuff like this in this little closet that people donate or we pick up. And we do those things on our own because this, we know, will get them out in a safe manner. There just should be more resources out there for these people.
But hospital care and length of stay is restricted by diagnosis. If a patient is medically stable and has insurance, then he or she may recuperate further in a post-hospital skilled nursing setting or receive help from a visiting nurse in the home. But what if you don't have insurance? Or worse yet, you don't have a home to go to?